Story tonight, the state of Tennessee is failing to protect some patients from drug-addicted nurses.
A 6-month community watchdog investigation found cases where the state's licensing board moved so slowly that nurses were able to get new jobs and continue to put patients at risk.
We'll tell you about these nurses shortly. Following our questions, a spokesperson for the Department of Health told us the agency improved staffing and procedures to minimize future delays.
He was the fine uncle, you know.
In the years leading up to Randall Fogelman's death, you call him Randy.
Randy, yeah.
The bedridden partial quadriplegic lived in a nursing home, dependent on the care of others. But one of his caretakers was also dependent. She needed drugs.
He didn't feel like he was getting it.
His niece still remembers Randy's reaction when he realized a nurse switched out his morphine with water.
He knew that it didn't taste like it should.
So she could keep it for herself.
He needed the medication.
It's a crime Mary Lynn Conkin compares to assault.
And they're inflicting pain, clearly.
Our investigation revealed nurses who divert drugs aren't the only ones putting patients in danger. We've spent more than 6 months looking over court cases and Department of Health records and discovered at times the state is making it easier for drug-addicted medical professionals to reoffend.
That is case number 41896.
Take the case of Daniel Jackson. The registered nurse used to work at Bristol Regional Medical Center in an intensive care unit until the hospital caught him stealing pain meds and falling asleep on the job. Hospital staff alerted the Department of Health about the drug diversion in September 2015. Just 6 days later, documents show he secured a new job as an RN at Johnson City Medical Center.
Within a month, he was already diverting.
And it wasn't long until a Washington County prosecutor says he was back at it, again in an altered mental state in a patient's room, taking pain meds.
Luckily, he was caught very early in the scheme.
Jackson since pleaded guilty to obtaining narcotics by fraud in both Sullivan and Washington counties. But despite those guilty pleas, the first in March of this year, his nursing license remained active for the next 7 months.
I'm very surprised at that.
The state finally took formal action yesterday when Jackson voluntarily surrendered his license and the Department of Health signed off on the decision. Then there's this nurse who's now serving time in prison.
I cannot imagine a worse situation.
The case is one of more than a dozen in Sullivan County that Deputy District Attorney Gene Perrin has documented involving medical professionals.
This is a large problem.
Cases, he says, show the scope of his frustration with the state's licensing boards.
I don't think the system works quick enough.
He says Michael Burkhart is the prime example. Burkhart once worked as an RN inside the cath lab at Indian Path Medical Center, helping with heart procedures.
Before the procedures even began, he was already withdrawing very powerful painkillers. This would be first thing in the morning as soon as he got to work.
Records show in September 2013, after the hospital fired him, staff alerted the Department of Health about his alleged drug diversion. Less than a month later, he found a new job as an RN. This time at a nursing home in Hickson, where he worked for 5 months before leaving under suspicion. From there, he landed another RN job, this one at a hospital in Cleveland. While under investigation, he confessed to his activities at Indian Path, blaming his addiction and telling investigators, "The meds help release me from my body." Still, even though the Department of Health knew Burkhart's history of drug diversion, it took almost another year and a half for the state to take formal action.
I kept hearing excuses after excuses after excuses as to why nothing had been done.
Long before Burkhart worked in Kingsport, we found out the nursing board placed him on probation in 2005 after 3 hospitals raised suspicions about him doing the same thing. In one of those cases, he admitted to stealing narcotics. But it wasn't until late last year, after Burkhart pleaded guilty to stealing drugs 61 times while working at Indian Path, that he lost his license, voluntarily surrendering it.
He should not have been able to continue to practice as a nurse and subsequently get employment at 2 different medical facilities while under investigation.
Both Perrin,
I think it is an emergency too.
and Washington County Prosecutor Aaron McCardle believe the state needs to take emergency action in cases like these. At the least, temporarily suspending licenses pending the outcomes of criminal investigations. Licensing boards have that ability if there's evidence the public's health, safety, or welfare may be affected.
Do you all take that emergency action?
Sure.
It does happen, but we followed up and discovered not all that often. Out of the more than 800 board suspensions, revocations, and license surrenders in the last year, the Department of Health's boards took emergency action just 6 times.
If there's not a clear and present danger, then the individuals are entitled to due process.
Commissioner John Dreisner says in the cases considered non-emergencies,
there are some bad actors out there.
It's the dishonest license holders who are the ones delaying the process. The agency reports cases become especially complicated and lengthy, with many more steps when license holders fight their complaints. The state says a successful disciplinary investigation needs sufficient evidence to bring before an administrative law judge, sometimes even a criminal conviction before the agency can take action. Plus, the agency says it's not all about discipline. Boards are also required by state law to try and help in the rehabilitation of impaired health practitioners. In Burkhart's case, the Department of Health says its employees started their investigative process shortly after receiving his complaint. But he initially denied the allegations and then failed to complete a rehabilitation program, delaying disciplinary action. The state also says while Burkhart worked at other facilities, it had no evidence he continued to divert. The agency reports it has taken steps to reduce future delays.
Are there areas you all can improve to speed up the process?
We actively seek ways that we can improve our processes, and we think it's important to be responsive to our customers.
Mary Lynn Conkin thinks it's needed. She knows what victims go through.
They're in a vulnerable position.
Randy Fogelman's niece says she's in favor of giving offenders a second chance eventually. But while they're under investigation, she says the state shouldn't put other patients at risk. The nurse who victimized her uncle pleaded guilty, served time behind bars, and her out-of-state license ultimately expired before the case went to court. Nate Morabito, News Channel 11, in your corner.
Both nurses in our story declined comment through their attorneys. Records show at one time the state thought Daniel Jackson's case was egregious enough to send to its attorneys for further investigation. It took more than a year for the agency to take action again. That occurred yesterday.